And then finally, our chair, Lee Elliott Major, who is the country's first professor of social mobility at the University of Exeter. And his work is dedicated to improving the prospects of disadvantaged young people. And of course, before he came into academia, he was very much in the policy world as chief executive of the Sutton Trust and a trustee of the Education Endowment Foundation. So without further ado, I will hand you over to Lee, who is chairing this session.
Thank you very much, Alice, for that introduction. So just to explain what this particular session is focused on, this is really trying to get to a debate about what the impact of the BCS70 cohort study and indeed cohort studies more generally, and maybe social science more generally, what has been the impact on policy and practice. So this was meant to be part of the celebratory conference to celebrate 50 years of BCS70, but we're of course having to do this online. Just one quote before I sort of talk about how we're going to organise this that I thought was interesting. This was just in the papers this weekend. This is from Theresa May, previous Prime Minister, saying about lockdown policy: "It looks as though the figures are being chosen to support the policy rather than the policy being based on the figures." And this is one of the challenges, I think, that we have in terms of influencing government policy, that it can be almost sort of policy-based evidence rather than evidence-informed policy. So it'll be interesting to see what the panel makes of that. But yes, this session is really focused on impact, and I think it's fair to say that we've made some progress in terms of social science, in terms of having an impact and ensuring that there are some incentives in the system to do that. And I think I can mention this, that Professor Alice Sullivan, Professor Emma Fitzsimmons and Dr. Preetha Patalay are all finalists in the ESRC Celebrating Impact Prize. I think that's due to be, the winner's due to be announced this week. So in terms of this session, what we're going to do is we're going to have 3 to 5 minutes from each of the illustrious panel members, and they're really going to focus on these sort of 3 questions. What impact has the BCS70 study had on policy and practice? What challenges have there been in terms of interacting with policymakers, and what lessons there are for the future? So we're going to have 5 minutes each, and then we're going to open it up to questions on the chat function, which I can then relay back to the panel members. So John Bunner, if I can hand over to you to have the first speech then for 5 minutes. John, are you able to start from now? Okay, can anyone hear John?
John, you're on mute. You're on mute, John. You need to unmute yourself.
Right, is that better now?
Oh, John, we can hear you. Right, John,
oh,
over to you for the first slot.
Fine. Well, I wanted to do this by pointing out, just drawing attention to a couple of major projects we did with BCS70, and trying to use that as an example of where the policy framework comes very much in contact with what the studies themselves were doing, and then look at some options in that area. What I want to talk about first is what we call the trajectory of disadvantage, which was a major theme drawing on the whole of the data set from birth to 37 at the time. And this work was done for the social exclusion unit at the time, because they were particularly keen to learn about the way this trajectory of disadvantage was actually shaped through time. And one of their main interests there turned out to be the staging post at 16, when young people were, of course, leaving education and moving to the various tracks that followed. And this is what we set out to look at with them. And come up with what would be useful in policy terms. They themselves were trying to rewrite a lot of the sort of approaches to this kind of issue. And this was therefore young people aged 16 to 18 who were not engaged in education, training, or employment, commonly referred to as NEET. The NEET characterization is a very common one even now, but it grew out of this work that we undertook for the social exclusion unit. And this is again, this came out of this whole program of analysis that we were doing in and around these issues at various stages, which is what the social exclusion unit was particularly interested in finding out. What were the causes and effects in these areas? And the key document that came out of this was Bridging the Gap, having established very much what the NEET characteristic was about and how policy might be moved to reduce the number of young people in this category. In parallel to this was another project, this time lasting, or more of a program, you might say, 15 years of research on the origins of poor adult basic skills, literacy and numeracy. Research was commissioned by the Basic Skills Agency and produced a series of very popular reports, culminating in the establishment of the Moser Committee, the brief of which was to eliminate adult basic skills problems and difficulties. A particular feature that became very clear in this, well, I should have actually mentioned first that one of the main policy results arising from this work, the Basic Skills Agency itself were in effect a policy organization, but I mean the Moser Committee arose out of this work as the body that would then take through a program that government could implement, again around this idea of social exclusion, but very much in this case focused on literacy and numeracy. And a particular feature that became unexpectedly central to the report was the significant disadvantage young women with poor numeracy had in gaining the kind of office work they wanted to do. Another key feature, which applied to both men and women, was the fact that if the skill wasn't used, it would deteriorate. And this was very much more important for numeracy than for literacy. Anyway, the long and short of it was that this particular finding led to a very strong development of what became the Skills for Life program, which was then implemented for many years to actually put a whole government investment into bringing about the changes in skills that clearly was sorely needed. A very challenging exercise, as you can imagine. Let's move on then now to the how to hit the issues of influencing policymakers, which comes second in the list you indicated to me. The main one of these is matching research interest with policymaker interest, including the mutually acceptable timetables and scheduling for the work that is needed. It is also takes time for new ideas to settle and be absorbed. Citing academic papers needs to be used sparingly, if at all. It is particularly important for policymakers to be fully engaged with this process in a way that they can find mutually acceptable, where their own timetables, agendas are really very similar from those of the academic world. So you've got this kind of tension between two kind of communities, the policy-making community and the community of academics, and their own different reference points. And somehow one is trying to bring about a combination in making a successful policy project work. And one of the most effective ways of this happening is, in fact, one of the government ministries, the Department of Education at the time, that went in for an annual conference where people were invited to come and talk about work in its early stages and the possibilities of new projects being developed. And these annual conferences were turned out to be invaluable for introducing both new research and new policy to each other, particularly such developments, say, as the digital divide, which was beginning to show at that time and very much became central now to the work we're currently doing. Turning then finally to the final issue of what are the things that affect policy in the future or might do? Well, the study's great value lies in its huge range. The coverage from birth to maturity and old age enables updating the individual records back to birth as each new sweep is conducted. The other major opportunity that needs promoting to policymakers is the facility to move forward and backwards from the 70 cohort to the other cohorts. This is an exceptional means of addressing secular change in a society, and of course it gives you this cross-checking capability to see whether something is distinctively unique to one cohort or the other, and having that capability means that the two project study or two cohort study project is particularly valuable, and of course was used extensively in the book we produced some time back called Changing Britain, Changing Lives, which immediately pinpoints the issue of one of seeing what is changing and what is stable in the society. And in this case, obviously the 70 cohort represented as the most recent of the three cohorts we compared from that point of view. Finally, the biggest advance of the release of is the release of administrative data from government departments, which have transformed the scientific and policy value of the studies. And BCS70 is a major beneficiary of this development. Anyway, the short papers of the kind produced by the Basic Skills Agency, I think, are one of the ways of attracting both practitioners and policy makers to the work that is capable and can be done. And through building this relationship of strength between the use of data and the development of it for academic purposes is, I think, one of the most challenging and most important and interesting aspects of the work we do. I think that's where I come to the end of my first 15 minutes, so I'll leave it at that, okay?
Thank you very much, John. That was brilliant. I've already got a number of questions that I'm gonna leave it till the end of the panel contributions, and then we'll open up to questions. So next we've got Leon, who again is going to speak for up to 5 minutes. Leon, over to you.
Lee, thanks very much. Great pleasure to be on this panel. Shame we can't be there in person. I do want to thank John. It's a pleasure to go after John. Never easy. He makes a lot of key points, but we all go after John in the sense that so much was established in the foundation of these cohort studies, and we have to remember Neville Butler and Heather Joshi and many people involved, Jean Golding and others, who created these tremendous resources. And I was lucky enough to come along and start using the data. But the strength of the impact, I think, comes from the quality of the data and the foundations that were set. And I think there are challenges in that as well. So I wanted to pick up the issue of the nature of the impact that cohort studies generally have had on policy and practice, and some of the challenges that follow from that. There are many examples of specific studies or specific analyses from cohort studies that have answered specific questions of interest. How much particular components of variance might contribute, some of the nature of developmental pathways and so on. But I tend to think that the big influence is a long-term change in policy thinking that has come about because through the cohort studies, researchers have been able to make visible and apparent to policymakers and indeed the wider public the nature of development and the importance of development. And so in a sense, some of the biggest impact isn't at all from specific studies, but from the way the cohort studies have come to frame an understanding of human development as emergent, as affected by multiple layers and characteristics of context, as diverse, and that has really shaped policy in this country until recently. I would say even up to Theresa May, we had a prime minister who would, in her thinking about social mobility, if not on every question, did take a developmental frame that recognized the importance of early experience or mid-childhood experience or transitions to adulthood, and that there are both stabilities and instabilities, continuities and discontinuities through development that really matter, and that helps focus policy in a developmental framework. And we see in a number of policy domains, even after the end of Every Child Matters in 2010, as we move into a coalition government in this country, the social mobility strategy or the Troubled Families program, whatever we think about the quality of the analysis that informed the specifics of troubled families or the nature of the evaluation, the thinking was very much a developmental risk, resilience, emergent development model that recognizes that children live in complex multi-level contexts and that we need to engage those contexts and children, and that the services that government has that interact with children and families need to respond to the very broad holistic developmental framework. And so I think, without saying much more about that, the framework of policy thinking has been really changed by the cohort studies because they've made this nature of development very apparent to people. And I think that's a tremendous strength and has been a change in our policy thinking. We can't really comment on what policy thinking is at the moment in this country because there is really just a great absence of policy in relation to children and people. But I think there is a challenge for the cohort studies in thinking about the future, because from that developmental framework and thinking about how policy affects lives and experiences, the weakness, it seems to me, of a narrow cohort study model, of a narrow individual longitudinal model, is the loss of the context. And I found increasingly that in policy work, place really matters. I think we lost some of the importance of place because the focus became on the sort of the average, all right, longitudinally and developmentally, but the average, rather than understanding how different development might be in different contexts. And I think that's a real challenge for the cohort studies, is place and similarly networks, kith and kin, and really reaching beyond the immediate child level to those wider contexts is difficult. And I think that's a challenge we have to address. Thank you.
Thank you very much, Liam. That was great. And by the way, for those who haven't listened to it, there is an amazing podcast that I helped to contribute to that on the cohort studies and BCS70 in particular, that is available, that we spoke to both John and Leon for. Pravitha, if I could hand over to you for 5 minutes. Yeah, over to you.
Thanks, Lee. So my name is Pravitha Patale. I'm going to briefly sort of talk about another aspect of the cohorts that is really valuable for policy research in the UK, and that is the fact that these cohorts are curated across multiple disciplines and across the life course, but they're curated as being a resource for the entire research and policy community. And the fact that they're sort of made available at no cost to all researchers, I think is really, really valuable, because you can be a researcher like me, fairly early career, not have great resources, but you still can access really, really high quality data to answer your research questions. And you might think this is always the case, but as most of us will know, this is not even the case in this country for other birth cohort studies. So I think the national birth cohort studies are really, really special in sort of being available at no cost. And this is something we really need to protect, because it makes lots of very valuable research possible. So I'm going to move focus a little bit also onto health, which is my area of research, and in thinking about the cohorts together. So as previous speakers have mentioned, the BCS70 is a really valuable cohort, but I think its value is amplified by being a part of a suite of national cohorts. So we have the 46 and 58 before it, and we have the Millennium cohort after. And just to highlight really important research that has happened when we put the cohorts together. So for example, in the area of BMI and obesity development, colleagues Will Johnson and David Ban have done really good research looking at the sort of development of BMI across the life course, across cohorts, but also how the experience of unhealthy weights has not been evenly distributed in the population. So for example, widening inequalities over time. My own research area is the area of mental ill health. And as Alice mentioned briefly in her introduction, I've done lots of work looking at adolescent mental ill health in the Millennium cohort, but then working backwards. I've never used BCS on its own. All the studies I've done with BCS have been multi-cohort studies. And I think this is really important, because when you think about how mental health is changing over time, we see a cross-cohort picture. Yes, mental health is getting worse over cohorts, but lots of data sets can tell you this. So the Health Survey for England, ONS data can tell you that mental health difficulties are getting worse for young people. And at the same time, smoking and alcohol and substance use is sort of decreasing over time. Weight and BMI is increasing over time. So there's all these trends you can see from lots of other data sources. The place where the cohorts are really special is once you know that trend in lots of repeated cross-sectional studies like the Health Survey for England, you really want to know why, like what happened before in these people's lives and how that's going to have an impact on people's lives for the rest of their life course. So the antecedents and consequences. And I think that is where a series of successive birth cohorts becomes invaluable, because not only do you see what's changing, you can see what might have caused things to change in people's lives, how inequalities are widening or narrowing, but also the impacts of this on people's lives as they age. And as Leon mentioned, like there's this importance of thinking about development, but I think there's also importance of thinking about context. And obviously these cohorts represent very different social contexts. So not only understanding the context within the cohorts, so the place they come from, but I think the context or the generations the cohorts represent and what was happening in the wider sort of social context at that time. So in terms of generational inequality, inequality more broadly, so inequality in Britain has not been the same since World War II. So I think sort of just to highlight that the cohorts together and open access are really, really special resource and have contributed a lot already, but will continue contributing to understanding things like what is the impact of increasing mental health problems in teenagers. In terms of the second question we were asked to comment on, which is the sort of challenges around engaging or sort of policy impact, I just wanted to highlight what John already highlighted really well, which was the sort of contrast between timescales and priorities. Like often government wants things fast, and research, good research, unfortunately, is usually slow and takes time. And COVID has been a really good example of how when we need important research, lots of fast research can happen, but it's not necessarily always really good research that's useful. But another thing I just wanted to flag is what we do as researchers. I think academic incentives are not structured to value policy impact or wider impact. Most academics or academic institutions or the funders or people care about your publications, your journal article publications, which oftentimes are not very easily understood by policymakers and the wider community. So I think there's an onus on us to do more to make what we research important to policymakers, but also communicating the findings of what we find to policymakers and their relevance with the caveats and the limitations that come with any research. And I think this is quite difficult to do. It takes time. Nobody appreciates that it takes time. Impact just doesn't happen. You have to have conversations both before you do the research, while you're doing the research, and then to communicate the findings of the research. So I think there's sort of an important thing there around thinking about how we value impact beyond journal articles in academic incentive structures, and why that is important if we want more of the research we do to have wider impact. I will stop there.
Thank you so much on that. I totally agree on the incentives point, and I hope we can get some discussion on that, because I do think we speak a lot about promoting impact, but I don't think we quite got it right as a system. Our final speaker then, Jenny, if you could speak for 5 minutes, and then I'm going to open up to questions. I'm going to ask you all a question anyway to begin with, by the way, because I've got lots to list. But please, for those who want to ask questions, do list them on the chat function, and I can relay them back to the panel. Over to you, Jenny.
Thank you, Lee, and thank you very much for inviting me to speak today. In preparation for the event, I asked colleagues across government for examples of how they've used the 1970 British Cohort Study, the wider importance of longitudinal evidence, and the value of this type of study in the context of the COVID-19 pandemic. So how have government departments used the data and evidence from the 1970 study, and what impact has this made on policy and practice? The Ministry of Housing, Communities and Local Government homelessness analysts have used the 1970 study to analyse the background to people becoming rough sleepers. The analysis was for internal policy development, but the findings were shared with Professor Bramley and Professor Fitzpatrick and fed into their 2018 paper on the risk factors for homelessness. BCS also featured in the Hills review of social housing. What this added was a more in-depth and longer-term perspective of the type of factors which contribute to longer-term tenure choices and housing outcomes. It didn't have an impact on its own, but as part of a wider set of analyses, adding to our depth of understanding. Now turning to the question of what is the wider importance of longitudinal evidence. MHCLG integration analysts have supported some analysis by Anthony Heath and ONS using Understanding Society data, a large longitudinal study which covers everyone in a household, from children to adults, allowing us to understand the experience of the whole population, and census data. It looked at intergenerational outcomes for BME groups, that kind of intergenerational analysis of socioeconomic changes in circumstances, especially among different population groups in different locations, is exceptionally useful. And the Avon longitudinal study of pregnancy and childbirth, an English longitudinal study of ageing, looked at the correlation between household circumstances, housing, and health outcomes over time. DFT monitors long-term trends in travel behaviour through the National Travel Survey. While the NTS provides accurate measures of travel behaviour, for example, how often people travel, for what purposes and mode used, longitudinal surveys collect travel data behaviour, which allows DFT to understand specific individuals' travel behaviour and access to transport change over time, and how this relates to economic, social and health outcomes, such as attitudes towards the environment, loneliness and wellbeing measures. Studies include capability, health and travel behaviour of older people, and access to transport and life opportunities. Some longitudinal studies have also developed data linkage capabilities, allowing for their data to be linked to admin data such as NHS or DVLA records. Finally, how can studies such as BCS70 and other birth cohort studies provide valuable data to policymakers in the short term in the context of the pandemic? English Housing Survey colleagues from MHCLG have highlighted that the team are currently collecting longitudinal data to monitor the impact of the pandemic. NACSEN are conducting 2 follow-up surveys with respondents to the 2019-20 EHS. The EHS Household Resilience Study is following up with over 5,000 households, asking them a range of questions about their finances and housing costs, as well as their well-being and experience of lockdown. Because the same households responded to the EHS pre-pandemic, the Household Resilience Study will enable us to track the impact of the COVID-19 pandemic on a representative sample of the English population. DFT has commissioned a bespoke longitudinal study, All Change, to track travel behaviour, attitudes and social impacts of the COVID-19 pandemic. The longitudinal data provides a better understanding of behaviour at an individual level, enabling us to track how people adapt and respond to policies and how their intentions and behaviours change. In summary, cohort studies are invaluable when considering changes to policy, allowing GSR today to take an evidence-based review of previous approaches and how they impacted on society. This is evident through the use of them in government today. The value of these types of study over the longer term for policy making is that they're neutral enough to show trends and impacts that sit outside the more short-term focus of individual administrations and ministers' priorities. Long-term studies are valuable during a crisis period to demonstrate the impacts that major events have had and how those have influenced changes in policy. The value of these studies is in understanding changes into society over time, thanks to the multidisciplinary nature of longitudinal studies. Before I close, one suggestion from MHCLG analysts. As well as including questions on homelessness and rough sleeping in future waves of the BCS70, it would also be useful to include the same questions in the Millennium Cohort Study in order to see how risk factors have changed between the two cohorts. And that approach is applicable to a whole range of important questions. Thank you, Lee.